Well, we're going to take an opportunity to answer some of the questions that we get in via email. We got a question specifically about ankle swelling, which is very common. This person is complaining of terrible ankle swelling every time they're on their feet a lot. So at the end of the day, their ankles are swollen. And they also have a complaint about varicose veins. So we'll talk about those two things. A lot of times they kind of go hand in hand, but sometimes they are independent. First, let's talk about ankle swelling. The number one thing we recommend to do right away is
water.
Water, drink. I mean,
because usually when you have what we call edema, okay? Edema at the ankle level is usually means a person, I mean, look, they could have congestive heart failure. And unfortunately, traditional medicine will take that and restrict the amount of fluids that they...
Yeah, they'll give a water pill.
Yeah, like it actually is the reverse of what they ought to do, because they ought to be taking a lot of water, let it flush out of your system. Your body is screaming for fluid, and you know what it does? It holds on to fluid. And you see it if you look at your ankles or your legs, that we call that edema. And a lot of times it's strictly corrected with water. 2 liters a day at least.
And for a person that doesn't have congestive heart failure or any kind of cardiac, a lot of times drinking enough water will solve the issue.
Yeah.
That's the first thing. Second issue could be due to nitric oxide.
Yeah, low levels of nitric oxide, which we're able to test. I think we're the only clinic, as far as I know anywhere, where we actually test nitric oxide levels. And that's very important because nitric oxide is what opens up your blood vessels. You know, it's the little chemical found in your blood vessels that, we call NO, and it just, it's like nitroglycerin. What is nitro do?
Dilates, opens up the blood vessels, allow for blood flow.
And if you don't have enough of that, that's a big issue. And
a lot of conditions will decrease nitric oxide content in the body, right? Diabetics, look how many circulation issues diabetics have. Really low nitric oxide levels. How do you increase nitric oxide?
Well, listen, I mean, we love our Navitol.
Yeah.
I mean, I don't think there's anything better to increase nitric oxide like Navitol, because it actually at the blood vessel level helps to strengthen the blood vessel. It gives it more elasticity. It rebuilds the collagen levels of the blood vessel, which is the elasticity in it. And B12 too.
Yeah,
B12 is an important vitamin for that. And we're big on B12 because the way we test B12, again, just a little sidetracked here, but I hear it, doctors sometimes even will call my patients and say, your B12 level is too high. I said, well, look, there's 2 ways of testing it. You can have B12 in your blood, but that doesn't mean it's in your cells, and it's not doing anything. It's
not functional.
It's not functional. Yeah. It's sitting there, but your B12 levels are too high. First of all, so what? What does that mean? And then secondly, if it's not in your cells, it's not doing you any good. And the vast majority of people, if you don't eat red meat, you have any digestive issues whatsoever, you have diabetes, any circulatory problems, including varicose veins and things like that, usually your capillaries are not working properly, and you need to open those up. I love Navitol, we love B12, and even our lake formula.
Well, and we'll talk about that now. So the
second part is very helpful.
Varicose veins. A lot of people have varicose veins. We developed a formula specifically for that. It's full of bioflavonoids, has stuff like hesperidin in there, which research has shown is a great natural way to treat varicose veins. And we get a lot of good feedback again on that product there. It really helps with varicose veins. So the two questions a lot of times are related, but we answered them independently. So again, we want to thank you for your questions. If you have any questions at all, you can email us at info@martinclinic.com.